A new report by the Canadian Diabetes Association called An Economic Tsunami, the Cost of Diabetes in Canada, paints an alarming picture of the state of diabetes in our country. New cases are being diagnosed at an increasing rate, as many as 20 Canadians every hour, every day. The report also introduces an important new tool in the fight against diabetes in Canada, the Canadian Diabetes Cost Model, which details the dramatic increase in the prevalence and cost of diabetes in Canada. Ellen Malcolmson is president and CEO of the Canadian Diabetes Association.
For the very first time, we have a diabetes cost model that's specifically based on Canadian data. And this model shows us the real and very alarming burden of the cost of diabetes in Canada today and in the future. Unfortunately, reducing the prevalence and cost of diabetes in Canada will take time and will happen very gradually. But we really have to take steps now in order to have that impact. We simply can't afford to wait any longer.
By 2010, nearly 3 million Canadians will be living with diabetes. Michelle Blackstock is one of them.
I was diagnosed with type 1 diabetes in February of the year 2000. And I think what a lot of people don't realize is that it can have a severe emotional and financial impact, not only for me, but also for my family. Despite having had health insurance, there was still a significant financial impact for my diabetes management in order to ensure that I could have access to the supplies and the medications that I needed.
The report also provides direction on how to address the burden of illness and the steps needed to ensure better disease management. With this new information in hand, the Canadian Diabetes Association is calling upon the federal government to renew its commitment to a focused federal diabetes strategy.
The Canadian Diabetes Association is committed to leading the fight against diabetes by helping people with diabetes to live healthy lives while we work to find a cure. Unfortunately, we can't do it alone. Governments can really help us with this fight by recognizing the growing burden of diabetes on the lives of Canadians and taking immediate action.
According to the report, if action isn't taken, the economic burden associated with diabetes in Canada will be more than $16.9 billion by 2020, an increase of $4.7 billion over the next decade. The number of people with diabetes in Canada is expected to rise by another 1.2 million by 2020. For more information about diabetes or to view a copy of the report, visit diabetes.ca. Sherry Dematarco reporting.